few minutes left. We treat a lot of head and neck cancers. Head and neck cancers are the cancers of the throat, the neck, and adjacent tissues. Nasal cavity, nasopharynx, all those passages that around the air and head and neck area. We have a very good friend, Ariel. You know him well. He's 43, and he presented with a mass in his left face by the ear. And the mass was getting bigger, 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 bigger. He went and had a biopsy, which was negative. He had an MRI, which was positive. It showed a mass. And he ended up going for surgery. He had resection of a real cancer, a mucinous cancer. And he saw the chief of surgery at a famous hospital. And unfortunately, the margins were positive. He had surgery about 2 weeks ago.
So that's something no one wants to hear after surgery.
Right. You don't want to hear because the surgeon told him.
The last thing you want to hear.
I left some in.
Yeah.
That's what positive margins means. I left some in. It means that it wasn't really radical surgery. Radical surgery, you remove all the cancer. Right. And usually you remove it with some margin so the surgeon doesn't touch the cancer cells.
Right.
So the surgeon told him everything was home free. He got it all out, and he came to me, and we got the path report, and I spoke to the pathologist, and the cancer, there was positive margins, 3 positive margins. And he wasn't staged, so we want to make sure that the cancer hasn't traveled. So the things you want to know after surgery, was the cancer totally removed?
Did it go to any nodes?
Did it go to anywhere else? One lymph node was removed, was negative. He came to me yesterday at 10 o'clock. By 5 o'clock, I had the patient fully staged with a PET CT scan of his entire body and planned for radiation. So the patient is happy because, number one, he did go through surgery. The tumor was by the parotid gland. The parotid gland is next to the...
It's next to the muscles of the face, and it helps make saliva.
And the nerves of the face, the facial nerve goes through there.
7 runs right through it.
Right, 7 is what?
Controls your face when you smile.
Right, the facial nerve is the 7th nerve.
Yeah.
So the facial nerve comes off the brainstem, goes to the face, and many tumors of the parotid affect that. So fortunately, he didn't have damage to the face. That's the plus. He did have an intermediate-grade cancer. There was involvement of the lymph vessels of that area, and there were positive margins. So he needs radiation to clean it up. He came for radiation because he knows me very well. And thank God he trusts me. I thanked him for his trust. We mapped out the radiation, so he'll have radiosurgery techniques to that area of daily treatments, and our goal is to eradicate those cancer cells, to make those cancer cells go away, to let him live his life and enjoy his wife and his 3 children. We have Dr. Eisen on the line. Dr. Eisen is a native Spanish speaker from Argentina. He's trained at a prestigious hospital, and his goal is to take care of patients in their native language of Spanish. So, buenos dias, doctor.
Buenos dias, Dr. Lederman.
How are you today? I just want to tell people that you're available. Unfortunately, we're at the end of the hour, but you are available for speaking in Spanish and going through all the details and spending a lot of time with your patients, correct?
Absolutely, and that's what makes the difference.
It makes a big difference. So how do people contact you if they want to speak with you?
For the Spanish community, it's
well, you take care of everybody. Just 1 minute. You take care of everybody, Spanish or otherwise. So.
For everybody, it's 917-836-8105.
Okay, again, can you give it in Spanish, please?
Right. That's 917-836-8105.
And English?
917-836-8105.
We're going to be on WOR tomorrow from 6 to 7 a.m. and 9 to 10 p.m., and we're going to speak to Dr. Eisen more during those shows. So thank you very much.
Okay.
Have a great weekend, Dr. Eisen.
We had several other cases that I wanted to speak about. We spoke about our friend who had this cancer of the by the parotid gland. We spoke about the man who selling fruits in Queens. I told him to go home and live his life and be active, that he doesn't have to worry about a low PSA. He's asymptomatic. We had another patient who's Jehovah's Witness this week who came with a large meningioma. She had symptoms. She had headaches. She had other symptoms. She was planning to have open surgery, which would have been a calamity because the tumor was by the optic nerves. It was deep in the brain.
And for anyone who doesn't know, meningioma is a benign tumor that grows near the skull. It can compress the brain and cause symptoms. Your brain doesn't have enough space sometimes.
That's right. Well, actually, there are meningiomas that can be cancerous.
Can be malignant.
Right. So there's 3 grades of meningioma. But she had a classic meningioma, which is not cancerous. We treated her a year and a half ago. She got a new MRI yesterday, and the MRI shows her tumor is regressing.
Great.
So she's in the 97%. Our success rate in treating meningiomas is 97%. We can stop it or shrink it or make it go away. And we have actually a special brain booklet that we send out to patients just about brain tumors, and you can call us at that 212 Choices phone number. We had another man who came yesterday who had terrible pain. He was suffering in pain. He's on narcotics. I saw him last May with lung cancer, and he refused treatment at that time. And I never understood why, because I had a nice relationship with him and his daughter. He's a Russian immigrant, actually a Ukrainian immigrant. He's been here many years, and basically declined all treatment from May until now. And now he's in terrible pain. He has bone metastasis from cancer. And bone metastasis usually respond very well to radiation and focused beam radiation. We can send in beams of radiation. And you've seen that kind of treatment, Ariel.
Yes, I have. It's about 5 days.
Usually 5 treatments, so it's very quick, very easy. We focus in on the tumor.
And the pain goes away a lot of the times.
Usually,
and the patient
yes.
doesn't have to rely on the pain medications.
Right, so we can get them off narcotics, which cause a lot of
Side effects.
Sure. I had another woman who had terrible back pain from metastasis. She came to me on a Wednesday. She was going to California the next Tuesday, and she wanted to have treatment to get rid of the pain before she goes to California for a good trip.
So she wants to enjoy herself.
And she just came back from her trip. So
yeah.
I got her treatments done in time.
Before California.
She gave me just a few days. We did the consultation, we did the mapping out, we delivered her treatment in the stereotactic frame at her office at 38th and Broadway. She was really suffering in back pain. She came yesterday. She just got back from California. And guess what?
She had a great time.
She had a great time. Why?
No pain.
No pain. The pain was gone. She went in the ocean, which she thought she would never do, in Huntington Beach. And you've been in Huntington Beach. I've been there with you.
It's
right?
nice.
With Rob. It was beautiful. She said the water was warm, and she had a great time thanks to the radiosurgery.
Outstanding.
So it's more than the radiosurgery hour. The radiosurgery is real, and if you don't believe me, we can have this woman call you if you want. I'd have to ask her if she'd be willing to, but I imagine that she'd
Good
be
testimonial
willing to.
there, Doc.
Yeah. And another patient came in from Greece with big neck veins. There were swollen neck veins on one side of her neck, which made me think of what?
Some lung cancer, maybe some superior vena cava syndrome.
Yeah, whenever she was speaking, her neck veins on the left side newly were distended. Yeah. Usually your neck veins go down when you speak because you're breathing and the pressure brings in the blood from the head down to the heart.
It's paradoxical there.
Right. So what would you think of?
I would think of some lung cancer.
Right. So she came in from Greece. Within 45 minutes, we had a contrast CT scan. The good news is...
Not everything is cancer?
Not everything's cancer. She was A-OK. She just happened to have an abnormal blood vessel. She's A-OK, even though she's been around smokers for 25 years. Mm-hmm. We're almost at the end of the hour. We invite you to tune in, to call us during the day. You can call us at 212-CHOICES, 212-246-4237. We have a free booklet and DVD, and I'm happy to send it out to you. We wish you well. We know it's an early hour, but we know we have regular listeners. So please give us a call if you have questions. Please have a good day. Ariel Lederman, thank you very much for being our co-host. You'll be back next week. John,
I hope so, Ariel.
Thank you very much.
Thanks for having us.
Always a
God
pleasure.
bless you, and have a fantastic
Have a great
week.
week in New York.
Right.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.